Adolescent obesity weight loss revolution. Meet the teen generation using Wegovy weight loss and Zepbound weight loss. Hi friends, I'm Elizabeth, Countess of Shopping. Super excited on today's episode. I've got some fascinating studies that we're going to talk about in regards to adolescent weight loss, teen weight loss. If you're a parent like I am, this is the episode for you. If we don't know each other, I'm Elizabeth, Countess of Shopping. Over the last 16 months, I have taken GLP-1s and have lost over 88 pounds on my 100-pound personal weight loss journey. Started off on Mounjaro because of the Mounjaro shortage, moved to Zepbound because of the Zepbound shortage, have now moved to compounds. And today's episode, we're going to dive in talking about adolescent obesity and a new study that just came out, that literally just came out. If you've got teens that are suffering with the disease of obesity and having chronic obesity management care, we're going to dive into that today. Let's go ahead and talk about it. So there's a new study that came out from Joyce Lee, MD. MPH served as a lead author on a paper recently published in a JAMA, J-A-M-A, and I'll link this down in the description link below. Just click that ... more here on YouTube, and that's going to show you all the links I'm referring to today, and of course, citing my sources. So Dr. Lee basically wrote this paper as a lead author on it, dispensing the glycogen type peptide 1, that's GLP-1, receptor agonist to adolescent and young adults from 2020 to 2023. And this study found a rapid increase in the weight loss drugs of Wegovy and Ozempic in adolescents and adults aged 12 to 25 years old. What we're not going to do on today's episode is have judgment, guilt, shame, condemnation. I don't do that here, but we are going to talk about science-based information to make educated decisions. With this study, it's referring to Wegovy, which is FDA approved for chronic obesity management. Ozempic is approved, FDA approval for type 2 diabetes. Ozempic is frequently off-label prescribed for chronic obesity management. Just to make sure we're clear on that we're talking apples to apples. I have thrown in the title Zepbound weight loss, which is manufactured by Eli Lilly, a different manufacturer than Wegovy. Wegovy is manufactured by Novo Nordisk. Eli Lilly is the manufacturer of Zepbound. Zepbound is also FDA approved for chronic obesity management. Okay, now that we're on the same page, and it has Mounjaro, which is the same thing as Zepbound, which is FDA approved for type 2 diabetes. So now that we're hopefully speaking the right languages with GLP-1 medications, in terms of this study, it was specifically for Wegovy, but I will, not the study, be referencing Zepbound weight loss in this conversation because it has slightly higher data with it, not in this particular study, but overall. Okay, so going through this study, fascinating. They studied it back from 2020. Now it's talking in here about that there was now a nationwide study from Michigan Medicine shows the use of weight loss drugs increasing rapidly in adolescents and young adults aged 12 to 25, especially in females. Using 2020 to 2023 data from a national database representing 92% of pharmacies, and a study team found a 594% increase in the monthly number of adolescents and young adults using Wegovy, Ozempic, and other glycogen-like peptide 1 receptor agonist GLP-1 IRAs for females. This increase was even more pronounced amongst females versus, of course, males. The number of female adolescents 12 years old to 17 years old using GLP-1 IRAs increased 588% compared to with 504% for male adolescents. The number of female young adults ages 18 to 25 years old using GLP-1 IRAs increased 659% compared to 481% in young males. Okay, so talking about these, I think this is such an incredible conversation to start to have. Again, not having guilt, shame, or condemnation. I had my own views on adolescents taking GLP-1 medications like Wegovy, like Zepbound. When I went on the Oprah show, I actually, when I was a guest and then was also on the Oprah show, on the after show, you can still see that, by the way, on Hulu for the Shame, Blame, and Weight Loss Revolution. If you're looking for that episode that I was on the main one with my before and afters. And then the after show, I actually talked to Oprah, bawling my eyes out. But on that show, they had an adolescent as one of the guests on the show. And that is where my brain shifted. And then we're going to get back to talking about the study of why I think it's so important. in my brain, I was like, would I have my own 12-year-old daughter or son be on GLP-1 medication? Well, recognizing that obesity, chronic obesity management is a disease, that obesity is a disease, like high blood pressure is a disease, like cancer is a disease, like type 2 diabetes or type 1 diabetes is a disease, and that they need medication. Like a type 1 diabetic, I have multiple type 1 diabetics in my family, that they have a disease of where they need insulin. They need it, right, to help with their disease. Same thing for me for having chronic obesity management. I need medicine for my disease. And then if you go back, there's different spectrums of obesity, chronic obesity management. When I was 12 years old, there's different spectrums of it, I think, and I think that there's still so much research and studies to be done on this. But I think what's interesting from the study and then where we need to take this conversation is one, talking about the study, and then where do we go from there with this conversation of that? If being a child who was on my first diet at 10 years old and being super successful in every aspect of my life except for food and except for weight management, now having tremendous success. I mean, 88 pounds lost in 16 months after trying every single diet. And I know I'm not alone on that, of trying Jenny Craig and Nutrisystem and Weight Watchers and Atkins and then being successful because of GLP-1 medication. Why not give that gift to my kid? I'm thinking from a perspective of being a parent, of if my kid had obesity, which my son, the Duke, doesn't. He has his father's structure in that regard that he doesn't. Would I then allow my kid to have access to GLP-1 medications? And that's what I think is interesting from the study. One, I think from 2020 to 2023, the access to GLP-1 medications with that too, certainly I'm sure is of why there's 500 plus spike in that studies. But then it says interest in these drugs, and I'll cite my source down below. It was from diabetes.med.u Mich, M-I-C-H, because it's University of Michigan.edu, and then the rest of the handle will be below, is interest in these drugs surged in 2021 when semaglutide was approved for weight management in adults with the brand name under Wegovy, and increased even further when Wegovy was approved for weight management in adolescents at the end of 2022. The report finds that endocrinologists, family medicine physicians, and nurse practitioners were among the top prescribers of GLP-1 RAs to use, suggesting these clinicians should focus on efforts to ensure safe and appropriate prescribing. For example, because the biggest usage increase occurred in females, clinicians need to educate female patients on the potential safety risks of these GLP-1 RAs during pregnancy. And so that's part of this conversation too, of having kids at 12 years old starting their periods or starting their periods before then for young ladies. That is one component of, for me, my GLP-1, and I'm in my 40s, whacked out my periods. And I've done other videos here on YouTube. In fact, I've done over like 250 plus videos in the last 16 months on GLP-1 medications. My periods got whacked out from my hormones. Now, could that be partial perimenopause or going into menopause? Just in general, even before GLP-1 medication? Probably. But I do significantly think that that is one of the reasons why my menstrual cycle got whacked out, was because of my hormones, because of the GLP-1 hormone. And so therefore, with a 12 to 25 years old, there's hormones going. You're not fully developed. And I think that's the biggest thing, is growth and development for younger kids, adolescents, teens, taking GLP-1 medications and having, like they said in here, having those conversations, but also for the pregnancy standpoint. So I've done a full video on this before, but in terms of to get caught up to speed, Eli Lilly for sure tells us, for sure, on the Zepbound warning label, if you titrate up a dose, you should, for 4 weeks, take an additional form of birth control if you're taking a birth control pill, to use an additional form of birth control, or you could get pregnant. Like that, just right there from the dosage standpoint. And many of you probably don't know that. I didn't, and I'd been taking it for like a year, and I was like, what? Yeah. Bok bok? Yeah, maybe you didn't know that. For me, that was very eye-opening. And I'm not sure if Wegovy has, I'm sure they probably do. Well, I shouldn't say I'm sure. I don't know. I don't know. But I'm assuming Wegovy has, and Ozempic and Mounjaro all probably have similar labelings on that too, of within that first 4 weeks of titrating up to use an additional form of birth control if you're taking the pill. Also, I know previously from significant amount of weight loss, I lost a ton of weight on keto, gained it all back and then some, but lost, and that was when I got pregnant with my daughter. And so knowing that with weight loss for me, I become fertile myrtle, that was obviously on my brain with using a GLP-1 medication too, because my hormones were changing, that I am at higher risk of getting pregnant just in general when I lose weight. That was on my brain. So that relating back to these adolescents too, I mean, in prime time talking about pregnancy, of teenage pregnancy as well, of taking these two and having those conversations with those two. So and using additional forms of birth control as well. And that's a topic for a whole other thing. But talking about these components on there, I think is super, super important. Let me go over to, I have another article that I wanted to talk along the same topic with, was talking about the increase of these medications, of literally, let me go back over to the facts. It was about how 588% among female adolescents, the increased from ages 12 to 17 years old. And going back to my own standpoint, again, going back onto the Oprah show and riffing off that a little bit, of when I watch in the Oprah show, I'm like, no, people shouldn't take these until they're 18 years old. Zepbound and Mounjaro, it is 18 and older. Wegovy is 12 and up. So I had thought, no, shouldn't. But then hearing this compelling story of a teen of having obesity and a varying spectrum, a higher spectrum from what I experienced as a teen. And for this teen, talking about, I mean, she was morbidly obese. And how GLP-1 medication she wasn't on Wegovy because they couldn't afford it. It was a different GLP-1 medication that their insurance did cover. How successful she had been with it. And how much it had essentially changed her life. She was able to make like the cheerleading squad and be able to go to a dance and things like that, of the emotional component with it as well, of being a well-rounded individual, not just physical, but also the emotional component with it too, of not being morbidly obese anymore from her. And that Oprah experience, it brings me to tears thinking about it. Like, I couldn't imagine having a teenager that is hard in itself, but then adding in the weight component of it, and with chronic obesity management as a disease, adding those decisions in because we don't have enough information yet, right? Like making these not judgment calls, but these calls for our kids of what's the healthiest thing for them and the best thing for them. Because as a parent, I want what's best for my kid at the end of the day, of course, what's in their best interest. And that's what I think is interesting about these medications. Is it in their best interest, right? And for some, yeah. And for others, maybe holding off until they're fully developed, or waiting to, like my obesity at that point, I was overweight, but I don't think, just judging off my recollection of it, I was overweight for pockets of my childhood, because again, I had been on diet since I was 10, around 10 years old, if not earlier. And having those pockets of where I lost weight and then gained it back, because at the end of the day, I always gained it back. With obesity, always gained it back because I have a GLP-1 hormone deficiency. Someone had asked me, by the way, about how you test for that. I tested for that by my pant size. I don't know, and I'm throwing this out to the Countess of shopping community. I don't know if there is a test for a GLP-1 hormone deficiency, like an actual, I don't think that there is, but someone asked that question. I thought that was a really good question. And so I'm throwing that out to the Countess of shopping community. You guys always write really amazing comments, and also in my private group that has thousands and thousands and thousands of people on GLP-1 medications as an encouragement group, which I'll link that down on the description link below. I think it's important to have these conversations about that too. I don't know the answer to that question, but going back over to the teenager standpoint of it, of if this helps to prevent type 2 diabetes by having GLP-1 medications available to help prevent type 2 diabetes, I don't know. Like, that's the answer of where I don't know. And I think that this comes down to, we need more information about the growth and development. This study just talked about the increase of it and where the prescriptions were coming from. It didn't talk about, and this is what my husband, the accountant, and I talk about for adults, let alone teenagers and adolescents ranging from 12 to, 12 to 17 years old, what the long-term implications are of taking this. And we don't know. I know for me, I'm 16 months in, I'm at the highest possible dose. And for me, my appetite suppression has dramatically lessened. Of course, I am so incredibly grateful. I feel like I've hit the lottery ticket to be on a GLP-1 medication. But my appetite has changed when I first started versus what it's now. And I think I erroneously thought that when I first started taking a GLP-1 medication, that appetite suppression was going to be the rest of my life like that. And that has not been the case for me. 16 months in, this week, I didn't lose weight. I didn't lose weight because I was hungry, which I'm going to talk about on another video. And so the appetite suppression, I wish I could go on a higher dose, but I'm at the ceiling. I'm at the absolute ceiling of where I can be, at least for the next 2 years, maybe 3 years, depending on if retatrutide comes out or if Mounjaro / Zepbound or Wegovy get these higher doses approved, FDA approval for them. We'll see. I think they're in clinical trials right now, I think, is what some of y'all have shared with me. I have not confirmed that second piece of that. But where we go from that is if someone is on these, like a teenager, with my experience of it being 16 months on this, that now there's nowhere, I've like hit the ceiling, I've hit the max, and then where do I go from here? What then happens if it's a 12-year-old on this and they're 12? I'm in my 40s, right? So that's where I think these questions, and again, not judging. And I had walked in, I think, when I was on the Oprah show, somewhat judgmental, and really got a dose of reality of listening to this teenage mom saying, basically, walk a mile in my shoes with my teenage daughter of having type 2 diabetes. And then the other component was, okay, then maybe having like lap band surgery or bariatric surgery. Is that better than this? I mean, like going through for bariatric surgery for a 12-year-old, you know what I mean? Like, is that like, and I don't know if they even do that. I'm just saying, like, the surgery component of that, even if someone is 18 when they turn to adult age here in the US. And I don't know, also the other thing I don't know, a lot of unknowns that I'm posing too of internationally. We now have so many people in the Countess of shopping community who are in Australia and the UK, and as we even have folks in the Middle East, as these drugs continue to roll out and having access to them for GLP-1 medications, the Countess of shopping community has become international. But how that is in terms of international laws as well with these medications too. So, and then I go back over to one of my other notes that I had on here about this study as well. Zepbound for sure, the maker manufacturer of Zepbound for chronic obesity management, the maker Eli Lilly, 100% tells us in the literature to work on, we need to change two things. One, physical activity, and two, basically our food choices associated with that too, making a lifestyle change for activity and lifestyle change within those food choices. And so having those lifestyle changes at 12 years old or 15 years old or these other ages, something to think about. Like, again, there's pros and cons, and my heart goes out to parents of children who are obese and dealing with chronic obesity management, and then the treatment of that, of what decisions do you make. But the study is showing here, the proof is in the pudding. I mean, 500 plus increase amongst females, and not including adolescent males. I think different struggles for both, right? Like similar and also different for females and male adolescents on these journeys too. So bottom line, I think that the study's interesting. I think that it's interesting that Wegovy is getting prescribed for, I didn't know that, for 12 years old and up. Zepbound is not, it's 18 and older. And we also do know one other thing to think about, like just in terms of brain, I love brain studies. I love nerding out of brain studies. Our brains do not fully develop the prefrontal cortex until we're 25 years old. That prefrontal cortex of our brain is decision making. That is where we're making decision making skills. That part of our brain's not developed until we're 25, right? And so, let alone 18 years old, you still have 18 years old, you still have 7 more years of that of making those problem solving decision making skills. I think my prefrontal cortex took even longer. No, I don't know. I feel like I was slower on those decision-making skills. I didn't come into my prime. I think it's all like my late 20s. And even then, somewhat, it was, I don't know, it was decision-making was challenging. But perhaps for all 20 years old to begin with, let alone teenagers. And that's where I think we'll continue to have these conversations. But the study does point, I mean, the study is profound. It's the first big study about kids, youth, teenage, 12 years old and up taking GLP-1 medications, and that there's still so much space. I'm trying to find the exact quote in here because it was a really good one, talking about we need to know more information, right? Let me go, it was in this other article. It was talking, yeah, the safe use of it is finding, hold on, the most significant, no, that's not what I wanted to read. it was basically saying that we need more information and that more studies are going to be done on this. But I think for me, and probably for you if you're taking this, I outweighed the risk. I don't know what's going to happen long term to my body taking a GLP-1 medication. For me, I was willing to take the risk. When I first started 16 months ago, I was like, I will have 5 heads and I'll stand on all 5 heads if this helps me with my chronic obesity management, because I was in such pain, like severe pain with it. I had tried everything. I was desperate and hopeless. And I was like, if this gets me to help my body of where I can live longer, I can be healthy, I can work on these food issues and health issues and things like that, I'm willing to do it. For my kid, it would be a difference. I don't know. This is where it goes into of the parents making decisions on these as well. It's hard, and I want to validate that. And I don't have experience, strength, and hope in yet, because the Duke does not have, as I mean, he doesn't have, he doesn't have that. He's not obese, and in fact, he's less than obese, less than like he's somewhat at times underweight too, like super athletic and super. Anyways, I'm not trying to talk about my kid. I'm trying to talk about in terms of these studies and parents making the decisions on those. But I do think it's interesting about the increase of those. One other point that I think I always like to make, because I do want to be factually accurate, which I have some updates too of my being factually accurate. There's 3 that I'm going to talk about here at the end of the video as well, is Dr. Lee, the one who was the lead author in the study. I always like to know where the money comes from. Reported in receiving personal fees from GoodRx, Tandem Diabetes Care, SNAF-OFI outside the submitted work. Oshman reported stock investments of Eli Lilly, divested in 2022, and Abbott, divested in 2022, outside of the submitted work. Gurazide, this is in the article linked for the specific spellings of these names, reported receiving grants from NIH and NIDDK outside of submitting work. Chua reported receiving personal fees from Bender Foundation and U.S. Department of Justice outside of submitted work. I always like to follow the money trail on that, of like who's writing these papers, who's writing all of these things. And so again, this did come from the Elizabeth Weiser Castle Diabetes Institute at University of Michigan. So many questions, up-to-date information on that report. I'll link that down in the description link below. As always, I do require of myself when I'm talking about that I am not a healthcare provider, never to be interpreted as medical advice, simply my experience, strength, and hope of being on a GLP-1 medication. And my intention is to create a positive community for myself and others on GLP-1 medication. And so I made 3 mistakes, because I do want to be factually accurate, that I want to correct. 1, magnesium. There was a Memorial Day sale, and I apologize. I said it was 20% off for my favorite magnesium, which I will link down below. I do have a discount code QUEEN, which is normally 10% off. I said in a previous video it was 20% off for the Memorial Day sale. It was actually 15% off. My sincerest apologies. I know some of you emailed the company and they emailed me, and I was like, oh my gosh, I felt horrible that that was not my intention. I apologize for saying it was 20% off when it was for the Memorial Day sale, 15% off. But now that the Memorial Day has passed, it's 10% off. Second mistake, I had mentioned this incredible face mask for red light therapy as my Ozempic face. So we talk about Ozempic face, and my face has dramatically changed. I mean, my face, here's my face previously. My face has changed quite a bit through losing 88 pounds. There you go. And using red light therapy, I had talked to my doctor at my medical spa. She is actually a board certified anesthesiologist and brilliant. She's brilliant. And her team also is nurses. And one of the nurses I work with was talking about red light therapy and using FDA approved red light therapy. So in my Amazon video, I had recommended this product. In that product recommendation, an amazing viewer told me, hey, Elizabeth, you said it was FDA approved, but it actually, I want to make sure I clear this up so it's perfectly clear. And I'm going to pull up the sales link so you guys can see. It's FDA cleared. It's FDA cleared, but in there is how this is where I got FDA approved, was on this sales link in my Amazon sales link. It says FDA approved. It says FDA and 510K approved medical grade device. It's where I got FDA approved. And when I type searched it in Amazon, that is what I got for this red light mask. In the sales page link, it says FDA cleared. in that piece there, it says, I want to make sure my address is not showing as I'm like flashing up my Amazon account here. It says FDA. I take that, interpret it as FDA approved. Apparently it's not FDA approved, even though that is confusing. It's FDA cleared, which would be different. Nonetheless, I still, even with that information, but I wanted to correct it to make sure it was totally correct for everybody. I still would purchase, and I bought this with my own money. I was not gifted it. I'm not sponsored by them. I still would buy it again because, let me go back down on the sales page link. I wanted to make sure I completely updated this for all of you guys because you had asked. I had gotten several questions on that. Let me go over to their sales component on it. Was the lights that they had. The spectrum of lights to me was why I was interested in it. I want to pull up exactly their intensity and color. They had all the different intensity and colors and the level of spectrum in terms of the light on there. Maybe it's up here. They had all of these different lights. Maybe it doesn't say. There's a certain number of, you can see the lights on the back. That is why I wanted this. That's why I wanted this. So I will be reviewing with my doctor at my medical spa. She's a doctor. More about this. If I have an update, I will absolutely give it. So anyways, I wanted to clear that part up. As I have more information on that, I'll continue to let you know. I have been doing red light therapy. I've been doing red light therapy for a long time, but I'm trying to find the best one. There is several FDA approved ones, but to my knowledge, they're $1,000, $2,000, $3,000, and I'm not dropping coin on that. Right now, this one is, it's got a coupon with it right now too. So it was under, with the coupon, it's like $160, depending. So, and prices obviously change on Amazon, but I wanted to tell you, that was where my process was. So it is not FDA approved, even though it says it's FDA approved. It's saying in the sales literature, FDA cleared, but I wanted to explain why I said what I said. Number 3, in one of my videos, I talked about injections with brand names, Wegovy, or I'm not on Wegovy, but I have been on Mounjaro, and then because of the Mounjaro shortage, Zepbound. Because of the Zepbound shortage, I am now on compounds. I had said in one of my videos, for me, my stomach, I don't really inject anymore. I need to talk to my healthcare provider, as I always tell, it's not medical advice. I don't inject in my stomach anymore because it says on the sales, it says on for Zepbound, and then also for compounds too, of not putting injections into scars. My stomach, and this is where I want to make sure I'm being very clear for me of what my experience, strength, and hope is, and not medical advice or health, as I'm not a healthcare provider, but for me, I'm not injecting in my stomach anymore until I get further clarification from my healthcare provider at my next appointment with Join Fridays, which I'll link down below. You can use the discount code QUEEN. I'm not injecting because I have a ton of scar tissue from my stretch marks. My stretch marks are now white. And that looks like scar tissue to me, which if it's saying not to inject into scars, for me, all of my stretch marks are now scars. They're like little dragon lines, or not dragon lines, what are those? Tigers, like white tigers, like it's all this, and you will not see that. You will not see that here on Countess of Shopping. I will not show that. So I wanted to communicate that because some people were like, oh, well, I'm not going to be injecting. It sounded from some of the comments, and I wanted to make sure there was zero confusion on that. That is what I am doing. The literature does not say anything about stretch marks. I have scarring from my stretch marks. And so that's what I wanted to be really, really clear on, is that's why I'm doing that and not injecting in my stomach for now until I have further clarification from my healthcare provider. You talk to your own healthcare provider. This is never medical advice. But for me, because there's substantial, it's not a little, it's my entire, there's like not another part to put it in. My whole stomach, by where the area of where you're supposed to do the injection, is covered with scarring from stretch marks. So I probably, in about 16 months ago, would have been completely ashamed and embarrassed to admit all of this, but here we are. Apparently that's all gone out the window. But I do want you guys to know, because it says in the literature about not injecting into stretch marks. And so, or not, it doesn't say that. It says not injecting into scars, but my stretch marks are scars. Hopefully that clears that up. If you have any other questions, let me know. Want to make sure I'm crystal clear on my communication and there's no ambiguity with that either. If you guys want to take advantage of the magnesium, which you guys know, 7 types of magnesium, I'll link that down on the description link below. You can use my discount link, code QUEEN. LMNT also have a discount link for you guys too. And then also my protein shake have a discount code as well. the protein powder in there made specifically for folks on semaglutide and tirzepatide as well. So, because we know muscle loss happens and we combat that with protein. Okay, sweet friends, I think that's it for today's edition, and I'll also link all of the studies that I referred to too. Be kind to yourself. Oh, we got to do our emojis. Two things. One, your accountability. What are you doing today to move you closer to your goals? Tell me in the comments below. Two, your emoji today is going to be a bicycle. Bicycle, bicycle. And the emoji tells me, A, you made it this far in the video. B, I will pray over you. If you don't believe in prayer, I'll uplift you in positive thought. If you've made it this far in the video, I want to get to know you. I really want to know. There's thousands of you. There's one of me, but my sincere heart desire is to know everybody in the Countess of Shopping community. So put down below a bicycle. If you are not near somewhere where you can put an emoji, you can just type out bike. I know some of you are like, I'm working out on the treadmill. I can't do that. That's fine. You can type that in. Sweet friends, be kind to yourself, be kind to others. I'm Countess of Shopping. Count my blessings because life is delicious. I'll see you tomorrow. Bye, friends.